Welcome to She Been Ready, the podcast. She Been Ready is a conversation, a declaration, and a clarification that Black women have always led. On this podcast, I, Dr. Wendi Williams, educator, psychologist, leader, and auntie, will be joined by Black women who lead and those who have been led well by them. So, you don't have to get ready when you stay ready, and you can trust in the leadership of a Black woman because she been ready.
All right. So, Jen, I'm so excited to have you on She Been Ready, the podcast. I remember meeting you and seeing you for the first time. I followed your Instagram prior, and then at the American Psychological Association Council of Representatives meeting. So I sit in that board, and when you did your presentation, I was so taken up with you, and just I'm so grateful that we're in this space together today. So I feel like it was a first and early meeting, but now forever. Like online that feel like just like admiration or whatnot, like connect with like actual in person or actual person to person, human to human, like that's a beautiful thing. So welcome to She Been Ready, the podcast.
Thank you. Thank you for the invitation here. And thank you for your work in the world. Yeah, I believe that you were awarded something while I was there, and I just remember clapping heck hard. So thank you for all your work in the world as well. And for this podcast. We need this.
I love this podcast so much because it's about lifting up the stories of Black women's leadership praxis and understanding that it is a liberatory leadership praxis. And so it's a thing that I've been sort of recognizing and noticing in my work, that we, not to be essentialist, but we do sort of have some core ideas or values of what's good leadership amongst Black women. And I don't think that that's by accident. So I wanted to talk about it, and I wanted other people to hear about it. So here we are. So one of the first questions that we ask folks on the podcast is, how did you know that you've been ready? So the premise is She Been Ready, that you've been leading for, Black women, and I would say other folks of color and other folks who are not seen as dominant and, having the power within white supremacist organizational culture. And they're leading all the time. They've just not been identified as the, ideal leader or the known leader. And so that does sort of take away from the reality that we actually have been doing this work, whatever it is, leading in whatever way, shape, or form for a while. When did you know that you've been ready, that you were leading? I'd love to hear your story.
Yes. Well, I love that question. And it's funny because I'm like sitting here, like gnawing on it. And I think that the honest answer and the authentic answer is I sometimes still struggle with acknowledging, stepping into power, self-knowingness, calling, and feeling ready sometimes. Like there's a good chunk of time where I have my moments of, am I supposed to do this? This is really hard. Or, I need more community. I need more assistance. But when I step back and I'm really honest about it, and I really allowed myself to acknowledge that something's here and that there's this work that I'm doing, I feel like I'm meant for, that it was a culmination of my life's work and practice, and a culmination of the people that I've served and worked with, psychologically, therapeutically, even in activism circles. I would say I got lovingly in trouble by my then, this is a very quick, easy story, by my then boss, who was an elder, and we are super connected, and she's just an amazing woman. And she was an elder to me, and she was my boss at the time at the University Counseling Center. And I remembered that we had like a session limit. And I think like many counseling centers, especially working with majority poor identified Black, brown, queer individuals that are the first generation college students, first time in counseling, once some of these students started unpacking, and, maybe they're coming in for, related to relationship issues, but really
underneath,
right, and historical stuff and violence, and and as they're talking, she said, it's only 3 limits. We have a wait list of like 90 people. And I was like, I can't do that. so-and-so, I'm not going to be able to do that. And she's like, well, I need you to do that. And we had this was my elder, a fellow Black woman. And she's like, Jen, I need you to do it. And I'm like,
yeah, because it essence real trust me and tell me the truth.
yes. And so we had a really big conversation. And although there was a intergenerational age gap between us, I had to lovingly risk maybe the relationship in order to have this sort of maybe teachable moment for both of us, and explain a little bit about what I was seeing with a lot of inner city students, and being an inner city first generation college student myself years ago. And she said, I'm going to trust you on this. We had a big conversation. I'm going to trust you on this. I'm going to allow you to take the lead on this and try this new model. Here's what I need you to do. And I want you to continue doing your groups, because I was a big group person. And it started unpacking and flowing well. And so and I remember her saying to me, I guess you're ready.
Right? Yes, I guess you're ready. So leadership for you, can I ask, like, where you, not necessarily the actual counseling center, but just kind of regionally where you were in the US? Were you in the, yeah, where were you?
Jersey City, New Jersey.
Yeah, okay. So for you, leadership in that moment in some ways meant questioning the model, questioning the protocol, saying, and raising it lovingly, but raising the issue. Yes. And also knowing your boundary around, like, I can imagine for you as a psychologist and a new psychologist to say, I don't think it's ethical to open these people up only to be like, okay, we're done. Because our little model says that you should be able to tell me things in 3 sessions.
Yes. Yes, absolutely. And, also witnessing, trying to refer the students, so much attachment, trauma and dysregulation would come up. And no matter how much I was regulating and grounding and tapping and EMDR and connecting them to the person, they still had decided to open up to a number of us. And is that, wait, you're letting me go? Like, I know we said this in the beginning, 3 sessions, and they're like, yeah, but wait, now I'm ready. And I just need a little bit more. And I thought about all the times in which so many of our people, our students, again, particularly many of them were literally at poverty level, where they were told no, or they got comfortable somewhere and then it was quickly taken away.
You make me think of foster care. Foster disclosure, right now I'm reading a book on basically Indigenous history in the US, just like from soup to nuts. It's a good book. And I just got through the chapter difficultly around Indian schools. Yes. I just kept thinking of like the foster care and the social work and removal of children from families, like that. Those systems and structures that we live with today are built on the backs of Indigenous and Black folks in terms of what we do with people's children and who we think we are, the we larger royal we larger society, who we think we are, to intercede into the familial practices of people. And I know we're going to get into it, but like you telling me about these students showing up in that positionality, likely having histories influenced by that history. That's deep, man.
That's very deep. And I'm sorry. Yeah. And one of the things I'm thinking is also, and part of what I was never really prepared for having happened, even though I got my master's in NYU, then went to California for my doctorate, but I was invited back. I came back to the East Coast for other reasons. And then I was invited back because another mentor was leaving to be able to be with their partner in Canada. And this position opened up and they said, we think you'd be perfect because group is your modality, is your thing. And so we have this peer group that I was a part of that saved my life as a 20-year-old, like 10, 15 years before. And then here I was also now working in a crisis one-to-one triage, in the counseling center. And I'm thinking, wow, I remember this. And I wasn't really ready for when literally the students or the people or the clients sitting in front of you are a version of you, or younger versions of you or aspects of you or who you were. And so although I had worked on a great deal of my own personal stuff, it didn't mean that I wasn't touched or connected or really feeling the plight and even further invested in making a difference. And I know that those students and my work there at that university for 13 years is a very large part of why decolonizing therapy even started. Yeah.
So I already told you that I don't stay with the questions that I sent you ahead of time. And I really would love if we could just expound a little bit on that idea of like, as a therapist and as a therapist of color, I use those, whatever, right? With the history, with the legacy, what it feels like, what it means to be providing the care, the container, the healing container, or attempting to, for someone who mirrors you, who reflects you.
Yeah. For me personally, so at the time, I should also say that, again, this is part of what I talk about a great deal. So I don't want to sound like a broken record, but I was being also deeply exploited, right? And maybe not directly purposely from my supervisor or even hers, because they were also being exploited deeply. But I was also like coordinating a nationally recognized peer education group, doing the grants for those groups, co-facilitating an LGBT support group, teaching 3 classes in the evening. And I'm not joking. We're talking about for over 13 years straight. So no wonder I became sick, and many of us can become sick and burned out. And frequently it was put back on me to take care of myself better. And I think because we were all in it and so close to it, and again, these are well-intentioned, great people doing good work in the world. We were all so close to it, and all, I think, amidst the community trauma as well, experiencing vicariously the secondary trauma of our students coming in and say, oh yeah, my best friend was just shot last night, but I got a test today, so I'm here. Flat affect. Nope. Okay, sure you want to be here? Can we, can we work something? Oh, no. I just got to keep going. And so I think being around so much trauma of my own as a child and growing up in the inner city, and then the traumatic experiences I experienced in graduate school and in the doctoral program, which very much felt like a hazing of sorts for me, and I think many other, I can't really speak for myself.
I would say take the sip.
Look,
do that part.
Yes.
Yeah, right.
Yeah. And then coming back in and saying, feeling bright-eyed, bushy-tailed, excited, like I can't wait to do this work. I love this work, and I still do. However, I don't believe there was much space to process in the way that many of us needed. And not all of us were from the community, but for those of us that grew up in that community or surrounding areas like Baltimore, Philly, Newark, Orange, and what have New York City, Bronx, those of us that grew up in the inner city and then working with inner city students, very clearly seeing and understanding where there was need, where there were lack of services and access, particularly related to poverty, where some of our rules and regulations, not just as a university, but as a counseling center, were also impeding their ability to succeed, because of bus passes, because they're taking care of an elder at home and being the only one bringing in money in the house, because ... right? Because language might be a barrier and they had to go to immigration with their parents to help. And then have someone in the counseling center say, you have to take care of yourself and place yourself first. Yes. And yes. And, they don't want their parent to be deported, or they don't want their parent to be incarcerated again, or,
that's right.
And so really realizing that sometimes boundaries, in my humble opinion, sometimes we're really being talked about, seen, and asking these students to sort of engage in boundaries in a very Eurocentric white supremacist.
That's it. Yes. Yes.
Yeah.
So, please finish. I'm sorry. I don't mean to interrupt you. Just
no, I have to watch because I can keep going. You go ahead.
Yeah, no, you're good. Well, I'll interrupt, but I think it's probably a continuation, which is you run an amazing platform called Decolonizing Therapy. And I would love for you to talk about, like, how is therapy colonized? What I
believe, like I once had this job interview and folks were like, I was like, so what are you all looking for? Da, 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 da. And they were like, oh, we need to decolonize the institution. I was like, and it came up like 4 or 5 times. And so I asked the question, well, how is such and such colonized? Nobody could answer the question. Right. Because then you'd have to, it's like saying decolonize, you want to be against, but actually naming how it's colonized means that you have to name practices and processes and things that we're doing that are harming people. And it was interesting to like watch that silence. I imagine you're not going to have that issue. How is therapy colonized? Like what you named some things, and I kept thinking as you were talking, like I think she might mean that that's one of the ways it's colonized, and that's another way. But just like, how is therapy colonized?
Yeah. I would lovingly shout out, how is it not? Right?
Okay.
Right. How is it not? And again, this is as someone who I have hundreds of $1,000s of loans in a field that I adored, loved, believe in, wouldn't give myself in any other way to kind of energy,
Yes.
right?
Yes,
So I'm saying this in a critical, I always have to like, I feel like I have to preface this. And I think that's
but I feel like you walk with like overwhelming pools of overflowing love. So the fact that you name lovingly all the time, I wonder about that. I'm just going to say
Thank
it.
you.
But okay, I'm like, you are love. So with that.
Thank you.
Thank you.
So from the extremely Eurocentric, white, we can guess cisgendered and hetero, we don't know, men and theorists, majority men and theorists, who many of us have learned from in terms of psychodynamic theory, CBT, humanistic, client-centered, we could keep going.
Yes.
The ways in which indigenous practices, and indigenous, when I say indigenous, I mean globally, from our indigenous African to indigenous Central, South, North American, to the ways indigenous practices are co-opted, taken, kind of whitened up, slimmed down. I'm using all these words on purpose, and then we're not allowed to use them unless we have certifications. To the ways that the board tells us who, what, when, where we can do, how we can do, what we can do, how the licensure process works, the amount of money involved in the licensure process, how even though they say that there's time and space, I'm trying to, there's so many, I'm just like, I'm going to give you a few. How even when you need accommodations, which I needed for a licensure process, you're still not given the types of accommodations that are really necessary in order to take an exam of that size, study for an exam of that size. And that is not a reflection of how much we know, of how we can hold space for people, whether we can do clinical work, whether we can be a psychologist. So that's part of it in terms of some of the structures, not all of them, some of them.
And you haven't even gotten to the client. You're still talking about becoming the psychologist.
Yes.
Yeah.
We're not even, right? Because what I think is fascinating, even about the example that you provided, are the ways in which structures, centers, institutions are not willing to look at self, look at their own structures, their own behaviors and habits, and how almost all of us, including myself, right, without really thinking it through, can engage in extremely dehumanizing, colonized Eurocentric way, because we've been deeply entrenched and collectively socialized and psychologically socialized and trained in that way. And my belief is that we've also been in some way asked to be like emotionally like euthanized and like break off parts of ourself.
Time out. What does it mean to be emotionally euthanized? That's a big thing to say out loud.
Right? Yes. And I talk about that just a bit in the book, and I probably could have given it a whole chapter.
What is the name of the book?
Decolonizing Therapy.
Okay.
Historical Trauma and Politicizing Your Practice. It's a mouthful.
Okay.
It's a mouthful.
And it comes out soon.
I should know this off top. November 7th, 20. Okay. Yes, thank you.
So by the time this podcast airs, people can buy it and have it in their shelves. I know I will. Okay.
Thank you. Yes. And so the euthanize,
Yes, euthanizing emotionally.
This emotional euthanization is something I started realizing. I was teaching multicultural counseling and group process for counseling grad students and doctoral students. And I started noticing this trend.
Okay.
My students, where they would come to me and say, I've been ready for, almost like I was a coach. Like, I've been ready for this, coach. Like, I've been ready for this. And they weren't saying coach, but professor, I'd be ready for this. I'm dying to do this. And
Put me in, coach. I can do it. Yeah.
Year after
Yeah.
year after year. And I would consistently bring them back to, how are you holding that? Oh, is there any attraction there? Is there any countertransference? How are you feeling about this? How do you feel about that? Your mother is currently passing. Your client is currently passing, and they're 5. How is that showing up? You're constantly bringing it back to, how are you? How are you holding that? Where is that in your body? And I noticed that a lot of my students would start to feel, especially if I'm supervising them, right? A lot of them would, you're one of the only ones that are asking me this. Like, why are you focusing so much on the personal in their own ways? There would be this inquiry around why focusing on them. And I realized that there was this fear that they were going to kind of split off their feeling, and how often we're trained to sort of be neutral, right? To step into being neutral. And I think that's beautiful. I appreciate that. But we're also superhuman as clinicians, right? We also come with our own experience, not that we're consistently putting that baggage down and making it about us, right? That's where healthy boundaries come in. But this emotional euthanization of, where many of us are holding constant bags of intergenerational, historical, familial, current day trauma and oppression, right? And yet we're not really afforded the opportunity to slow down. We don't get therapy for free. I don't know if you do. I didn't, right? Right? Like, you would think, as part of the quote unquote hazard of the job that comes along with the emotional component and the emotional labor, right? Particularly, I would notice Black and brown women holding more than they needed to, and then their home lives in some way, shape, or form falling apart. And then them feeling as though they didn't have enough left over for their children when they got home, or they didn't have enough left over to date when they got home, or they would, I have fibroids, Dr. Jen. Well, I'm sick. They have to remove my uterus. They have to this, that I have migraines. There were all of these somatic symptoms that started to increase in connection with everything they were holding, because there was no way to put it. So for me, that emotional euthanization is, I'm supposed to show up and hold all of this, but I really don't have the capacity to put this down anywhere. I'm not really being shown or told or modeled how to put it down healthily. Maybe one person showing me, and I'm not supposed to respond or really react. Like, I'm not supposed to have these human responses. And again, we're not saying, oh no, what are you talking? Like, we don't want to sit in a session and suddenly fall apart. Being there for someone else. But it's sort of bringing in your humanity into the space and not forgetting. I hope that makes sense. I don't know if
No, it does. It makes complete sense. And you're trying to, it feels to me like what I'm having a lot of thoughts, actually. So that's probably why my face, if it looked in any kind of way, it's like, like that. We train psychologists to have delayed engagement with their personhood, particularly folks of color, BIPOC folks. So the type of working that you described for doing for 13 years is, I would say, mirrors some of that inability to plug back into self that you saw with your clients, and that we got to do it. Then there's like that messaging. There's the messaging that's within culture around, our ancestors could do it, so you can do it. But also, our ancestors did not want us to be doing this like this. And that while we're working in that way, oftentimes our colleagues who are not folks of color, who are not BIPOC, who are not coming from working class backgrounds or poor backgrounds or impoverished backgrounds or urban inner city spaces with dealing with the infrastructural challenges. And I would say coming from rural places and dealing with the infrastructural challenges too, but coming in, melanated skin and all the things, right? That there's not as much of a need for them to see it as that's the only way to go. If we're honest in terms of the breaks they might be given in some of those spaces, some of the time. But that the field, you started with the field being unrealistic in that way in terms of the preparation of the professional, but it seems like we are mirroring these like inhumane ways of being. And like, so your work to trying to get people to plug back into their humanity, like, no, but there's a you there. Oh
Yes.
no, but there's a you in there. Like, where are you in there? Keep,
Yes.
like continuing asking that question. Did you ever ask when you talked about mirroring the people who you're with, who you're working with, were you like, did you ask yourself those questions while you were asking them those questions? That must have been like
Yes.
a mind
Yes.
mess. I'm
Yes.
not using the
Yes.
curse word, but
Yes.
like,
Yes.
yeah.
And I would say that it was part of also receiving a lot of training and starting to be a resource trainer for People's Institute of Survival and Beyond and their Undoing Racism trainings.
I know them. Yeah.
And plus trainings. One of my mentors, Dr. Susan Espelin, self-identified white woman, she's like, Jen, you got to take this. You got to take this. And I'm like, again, I don't need to take an Undoing Racism training, honey. Like, she's like, no, really. And it really helped also help me. I was enraged, right? Like I was enraged almost all the time with my teachers, with the structure, with the system. And it only years later, being in therapy and all different kinds of different healings throughout majority of my last 25 years doing this work, it's only through that and working this out and understanding that when I'm feeling sad and I'm feeling like my boundaries are being crossed and I'm feeling like people are not getting what they need, or I'm not getting what I need, or what I'm being asked to do is absolutely irresponsible and not healthy and not what I signed up for, I become agitated. Other people become sad and internalize differently. I become like, I'm not a fun person to be around. I'm constantly going back and forth. It's a little bit of all my oppositionalness starts coming up, right? And so in this process, I'm going to therapy. It was like Humpty Dumpty every Friday, getting put back together again.
Oh, I thought you meant dumpty, like dumping,
No,
but you
sorry.
meant like breakdown. Okay, I was like,
Yeah,
okay.
it was like I was cracked apart. And then at Friday, I'd go to acupuncture, I'd go to therapy, and I go to this, and I try, and then Monday morning back again until I became very sick, physically sick. I was already becoming emotionally sick and out, and in some way being asked to do it differently. With less resources, less of a team and a staff. And more, I think that that's part of the ways that our field continues to dehumanize people. But I also want to say that in terms of decolonization, for me, my work and my structure is the emotional, psychological companion to literal decolonization. Meaning that if we're, we want to have the land and resources and ways of moving stewarded back by our indigenous people globally, right? Because there's a closer relationship, respect. We need to return it for all the reasons we know.
All the reasons.
Anyone listening to this podcast, we know. But this isn't a process that just, okay, we're land back, right?
Right.
And this work is not metaphorical. When I started doing this work 10 years ago, it's very much grounded in looking at historical and ancestral traumas and how this disenfranchised, suffocated grief and rage is often minimized because we had to survive. Our families had to survive. We weren't able to always act out or say what we needed to say and get it off our chest. And many of us still cannot.
No.
And how that was intergenerationally transmitted.
Yes.
How that became part of our personality, our families, our culture, and how current day oppressions and racial traumas and things of that nature, all the isms that we know, continue to exacerbate and reopen historical wounds, right? And so this work is a call to action for all of us, but starting with those of us that I believe have wellness and healing on our minds, to think about bringing it back to what we many of us originally were taught and our families were taught, and probably what we originally meant to do, which is to bring healing back into it and to take a step back and look at treatment and look at the medical model and look at the mental health industrial complex and look at how, whether or not we're well-meaning, including myself, and when I was well-meaning, how we play a role in school to prison pipeline / nexus, how we play a role in all the ways that children are still removed forcibly from families. How we play, we can keep going, how we play a role in incarceration, who we put away and who we don't, how we play a role in continuing to uplift the systems and structures of colorism and ableism and even eugenics, and how late stage capitalism plays a massive role in sometimes why we work as hard as we do and what we do and the practices we engage in.
So, yes.
I get excited when
I feel like, and so then how do we square that with this mantra? You need to go to therapy, or #therapy, or #I love my therapist. Like, there's also this sort of movement toward more people seeing accessibility of therapy and mental health supports, particularly populations and communities that have not always seen that as have had mental health stigma. And so how do we square that, especially when that we're not really ready in the field? It's not yet decolonized, and so we're sending people there while it's still doing what it does.
Yes. Let me just say, Dr. Wendi, there are times where recently in presenting the APA, I was talking about the colonial wound, and I also said, can psychology be decolonized? Like, can a white supremacist structure that was made to, I don't know the word I want to use right now, but like make Black and brown bodies and indigenous bodies fall in line and behave, and to over pathologize and over psychoanalyze us and pump us full of drugs? Is this really made for freedom? Right? Like, what are we talking
I feel
about?
like you're asking that question knowing the answer.
I do. Yeah,
okay.
Yeah,
right.
We can't, I don't
like, what are we rehabilitating? And is it a rehabilitate or is it a habilitate? Like, do we just make something new and different? So there's a radicalism attached to this decolonizing, because decolonizing suggests that we can undo something, right? But it almost sounds like you're saying something else, in fact, in a way.
We can't. And I tell people all the time that, an Instagram hashtag, a handle is what I had, and decolonizing therapy felt right at that time.
Oh, for sure.
A tongue in cheek. It's sort of a pull in, and to say,
yeah, it is.
So this structure, this paradigm needs to slowly, answering your question with like, how do we connect this with we need therapy? There's so many mental health issues and suicide rates, and so much people are dying, right? If you don't want to live, our youth, and all of this to say that we deeply, I think our youth and our elders and our earth are deeply crying out and letting us know that the way that we've been doing it in lots of fields is not working. This is incredible. That it was good for a while. I often respectfully say that sometimes I feel like the field is like expired ointment, like it's an expired ointment and a flesh-colored Band-Aid. You get the point. Flesh.
I got you. Oh no, you got my full attention with that one. I'm like,
who's flesh? Who's flesh? Anyway, what we gotta say? Yeah, right. It's very culturally PC, and I've taught cultural competence classes, cultural counseling. Again, no shade. I believe we have to have a little bit of brevity and lightness when looking at ourselves and honoring that our work is still important, because I don't believe a structure, system, work like therapy, psychotherapy, psychology, social work, they cannot just be pulled out, ripped out without a replacement. That would be, I believe, violent and dangerous.
You might enjoy a scholar that I've grown to love. Her name is Vanessa Machado de Oliveira Andriotti. I'll send you a link.
Thank you.
She wrote a book called Hospicing Modernity.
Say that one more time.
Hospicing Modernity. The premise is, we do need to shift and change things. And the shifts and change are going to be radical in nature, and we need a process of permitting the dying, like allowing the dying to happen. Right. Okay. So I kind of hear you saying that, like, tongue in cheek, whatever. And we do need to sort of enter this conversation. And one of the premises of her text is that engaging in this work is scary for people because we're saying we're undoing systems, we're going to undo everything, but there needs to be a sense of maturity, like
Yes.
a sense of us growing up to realize that it's not working. And so do you keep holding on to the thing that you're used to, or do you move forward now? And so I find it a really, I'll send you a link, but I find it a very interesting concept. And I think that the two of you have some ideas in common around what we might do with the field of psychology per se, or in the work of therapy.
Yes, thank you. Thank you for that. You know, as
Mhm.
we're talking and you're mentioning their work, I'm thinking to myself also
Mm.
the ways in which I know that I become very, let me say this, I become very emboldened, passion revived when I
Mhm.
work with and engage with a lot of the early career psychologists or
Mhm.
early
Mhm.
career social workers coming into the field, because that's part of what I had to help undo, and
Mhm.
still sometimes within my field and my colleagues, and they're
Mhm.
not going to hire a social worker, we need another psychologist. Like, well, I'm over here trying to find housing. I'm trying to
Yes.
find this. These
Right.
are, there's food
Right.
insecurity issue. What?
Yes.
You
Yes.
know,
Yes.
and there's clinical social workers that are really damn good at what they do too. So
Mhm.
even
Mhm.
some of this elitism,
Mhm.
mhm,
Mhm.
that I would
Mhm.
notice, and so that's one of my sort of soapboxes too, is sort of bridging us and like watching that divide and conquer that happens within a lot of our fields, whether it's marriage
Yes.
and family therapists, counselors, psychiatrists, really
Mhm.
just trying to continue those conversations and bring us together in this way.
Yeah.
And part of working with some of younger, I say, in terms of newer to the field,
Mhm.
sometimes I'll say, well, then do I do this? If we're in the process of undoing all of this anyway, then why am I doing this? And I always find that question or that line of inquiry scary,
Mm.
exciting, bold. I clearly never have an answer for them. I clearly
Mhm.
just have more questions for them to sit with, chew on,
Mhm.
make
Mhm.
decisions around, as
Mhm.
well as whether they want to do any kind of work with anyone that is dealing with severe mental health, right?
Mhm.
Imbalances or diseases. And, do
Mhm.
you want to know
Mhm.
theory? Whose theory? Pay attention to why you're going to certain schools. Do you want to work with certain professors or ideologists? And but one
Mm.
of the other pieces to this
Mhm.
is also looking at the ways that it is inhumane in the ways that we have engaged with people that identify as mad or have mental illness, right?
Mhm.
That have these psychiatric hospitalizations. That is a very violent, dehumanizing history. I have a whole chapter on
Right.
diagnostic enslavement.
Mhm.
Whole on
Diagnostic
diagnostic.
enslavement. I love your use of language.
Thank
Um,
you.
because it is that, well, I was thinking when you were talking about the students or the early career folks who were saying, should we even do this? There were similar conversations when I was in grad school in the early knots about the DSM and like just being anti-DSM. DSM is the Diagnostic Statistical Manual for Mental
Yeah.
Health Disorders, y'all. It's basically the book that tells us what psychological disorders are what, and how we know like what the symptoms are and whatever. And you know, we in my program there was a sort of like anti-energy, and one of our mentors said to us, that's fine, but if you're going to fight it, you have to actually know what you're fighting. You have to actually know what it is. um so I feel like that's the kind of work that you're doing with them too, and I thought, oh, how wise of you to not try to answer that question for them, because it is a perpetual question that that they must be tethered to in their field, and the answer is within their practice and the ways in which they reorganize and rearticulate what that practice is going to be.
Absolutely. Right. And that's part of, I think, like the kind of, if I may, the
Mhm.
leadership I believe that you and
Oh,
others
look
are
at you. I
continuing to, we're doing it different, and we're giving them, I would
Yeah,
imagine, a very different experience other
mhm,
than closed doors
yeah,
and a lack of depth and
yeah.
humanity within our responses and answers.
Mm.
The
I wanna
process.
ask you about rage.
Okay, yes.
'Cause yes, you're like, "Yay, rage." So recently you began some work on sacred rage. As I've said, I follow you in your work, and I really appreciate it. So there are webinars that are focused on rage and sacred rage in particular. I
Yeah.
wanna Why is rage sacred?
Yes. Oh, what a
Yeah.
beautiful question. I love this question. Yeah. Um, I believe, let me say this. rage can be destructive, right?
Yes,
Like any unchecked emotion that we do not form a relationship with. Right. And so when folks say, oh, no, I'm afraid of my rage, or I'm afraid of rage in general, that just lets me know that they've had some trauma, they've had some traumatic experiences around this, or it's been deeply, how do I say this? Deeply internalized and likely directed and targeted at self. And so there might be an increase, a lot of anxiety or a lot of grief and or what we understand as depression. And so I believe that rage is the love child of ancestral trauma, shame, and grief. Not just any grief, but as Dr. Maria Yellowhorse Braveheart talks about, like a disenfranchised grief within that trauma.
So you're not allowed to be angry, or you're not allowed to have the grief that you have, and so it's still in there. So this is what it becomes. Is that what you mean?
Precisely. Yes.
Okay.
And with that, yes, or that we haven't had enough space historically grieve it. We've had to move on because we were displaced or our children were taken away. We've had to just move on to another survival task.
Similar to what you're saying was happening for the students that you were working with, that they had to put their feelings and their, pain, their hurt, what they needed to heal through on the back burner because they had something more pressing to take care of somebody else, to take care of school, etc.
Yes, precisely. And so in my 20s, when I was in my doctoral program in San Francisco, California, my transformational therapist, coach, amazing Dr. Bola Cofield. One day I had an experience, and this is important. I write about this in the book, and I give a little bit of trigger warning. I'm not going to talk about it all here. But I was working with sexual offenders, an outpatient, and I was in a difficult, resistant deniers group. And I was working in this group as an intern with the ex-police chief of Oakland. Right. He decided to be a doctoral student, be a psychologist. And so I'm in a group with him with male identified individuals and a person that was incarcerated for many years for a violent offense started having an obsession with me and started following me. Right. I'm not going to get into details, and thank goodness all is well. And you're
here and we love you and you're here. But that must have been really scary as a 20-year-old. I was just
right. I was like
24,
25, super scary. My loved ones, my partner, everyone's across the country. And I had this experience, and I again talk about this in the beginning of the chapter where I'm walking home and I see the car, and and I had what we call like a East Coast knuck if you buck moment.
Listen, I have 15 years of Brooklyn under my belt. I pity the fool. I pity you. What did you do?
And I was on the phone with my then partner, and I dropped it. I'm telling him like, oh, I'm walking, I'm this. He goes, don't go down this block. He said, just call the cops. I'm like, what are the cops? Because of my experience with law enforcement.
They don't help.
And literally half of my cousins and my father's side of the family having been incarcerated, like by the time they come here, whatever. It was dark out. Anyway, dropped everything. And I'm like, as soon as this person gets out the car, I'm like,
yep.
I don't even remember. I blanked. I lost it. Now, psychologically, fascinating. I don't think I went back in my body and didn't remember what happened next for 3, 2, 4 days. I don't even remember. Like days later, I lost time.
Yes.
I didn't even know people could do, even though I was getting trained in dissociation. I worked in all these units, partial care, hospitalization. I lost time, and I was told later on, and I do remember people shouting out of their windows, gotta love Oakland and Lake Merritt. They're like, we're coming, sis, what do you need? People came downstairs. I remember somebody pushing me back and stepping to him. 10, 15 people outside, all different identities, genders, everybody just came together, even if I didn't know them. And I just remember not being able to stop shaking, right? So here's where we're getting to the rage piece. So the whole thing's a rage piece, but so out of my body, and I see her days later, and the next thing I know, I'm back in, right, where she's talking to me, and she did a lot of somatic work, and her work was like in transformational leadership, somatic embodiment. She was psychic, she used to be a nurse, she's a psychologist, she had everything, and got back into my body. And I thought, the first thing I said to her is, I was trapped. Said, you were trapped. Tell me more, Jenny. And I'm like, and I'm going on and on and on. And I was like, I have all this rage in me. I feel like it's going to kill me or someone else. Like, I feel like I'm going, like I need to do something with this. I'm enraged and I'm crying and I'm like heaving, sobbing, like, and I'm sad at the same time, but I have to hold it inside and put these in mask. She goes, you need to talk to my sister friend, Ruth King. Highly recommend the work of Ruth King, Black Buddhist, and her work is called Healing Rage, Women Making Inner Peace Possible. Highly recommend her book. At the time, she let me work it off because I was a doctoral student, again, first in my family, doing it all on my own. And she let me work off her retreat. And I was able to attend her 3 or 4 day Healing Rage retreat.
Was it up at Spirit Rock?
No, it was before Spirit Rock.
Okay.
It was, I think, in the beginning stages of her work. Really,
we're going to put these resources in the show notes because these are powerful pieces that we're talking about, including yours. Yeah. So it was before then. I'm sorry, I didn't mean to interrupt.
No. Thank you. And so Ruth's work helps me to understand the following, because I always love to identify my teachers as well.
Yes.
Really important. This is part of that decolonial work too.
That's right. And citing the work that's happened for you. That's right. Cite it, particularly Black women.
Particularly. And Ruth helped us really see that there's disguises of rage, probably more than the 6 that she's identified, but that rage doesn't just come in with the dominance and the defiance, the fight types. That rage also comes in and is disguised as distraction, as devotion, as dependence, and as depression, right? And the fight, flight, freeze types. And so I believe that Ruth's work was ahead of its time, as always. And I believe that she was helping us look at the nervous system without getting into the nervous system and talking about all the polyvagal pieces there, in terms of the brain and what have you, but really understanding. And there's a self-assessment, which is beautiful. And so I started doing that work. And then my dissertation was on the soul wound and intergenerational trauma in inner city youth of the African diaspora. And working predominantly with Black and brown youth, predominantly youth that are often incarcerated, in foster care with deep forms of multiple generational trauma. And rage was everywhere. Right? You're getting constantly locked up because they're angry, hurt. They push over a chair and say no, but meanwhile, mom is at home dying or being beaten, or right. So there's all these reasons why our youth were quote unquote acting out or AWOLing or going off at the handles. And meanwhile, we're not helping them to have a relationship and form a relationship with an emotion that is teaching them and can teach them that a boundary has been crossed, that they're feeling violated, they're feeling unheard, perhaps invisible, and that this feeling and what they're experiencing is simply a mirror, a reflection, a remembrance of what has also happened to their ancestors or lineage prior. And so I believe that rage is sacred when we take the steps to formulate a relationship with this very big emotion. And so this mix of shame, grief, and trauma creates this rage experience. And I believe for me and many others that I work with, the goal with rage is to have a relationship with it, to pay attention when we start to become agitated, or for some people, they become depressed for a while. And then it starts coming up a little bit more and they start taking it out on themselves. A lot of times when I was working with students, I would see panic attacks a lot, particularly in my 20-something-year-olds. And I liked when they started getting irritated and enraged at people, because that meant that
it was moving. It was moving. Yeah. Whatever was stagnant in there was starting to shift a bit. So one of the questions I had for you was like, that you're doing these webinars, and I wondered, why did you feel like it was important to do these webinars to help people connect with the sacredness or the righteousness of their rage, that they have a right to it, right? But would you say it's so that they can actually develop the relationship?
Yes.
Yeah.
We could talk about it. so I can educate. So the webinars are predominantly part education, and then a very gentle enough exercise, like a visualization, where I'm walking them through, that's where they need an elder, an ancestor, some or tree that could be an ancestor, where they're starting to connect with this rage, a sort of a safe totem, so to speak, or a token or a person, a safe place where they can go back to re-regulate, reground. There's some somatic exercises involved, as well as some ritual, because we have to bring in, I believe, our ancestral practices. And rage loves consistency. Rage loves to be seen and heard. And so I tell people, whether we're agnostic, atheists, whether no matter your identity, no matter your work, you can still have a sacred space for your rage. You could still put a picture out of yourself at 5 years old when you were tantruming, right? And maybe some like Lisa Frank stickers. I'm calling myself out here. I'm a rage altar. You know, a sacred, safe space where you're like, what do we need today? How's my rage doing today? Are we up? Are we feeling a little down? Do we need ice cream, full fat perhaps? Do we need a Zumba class? What does my rage need? And to name our rage child or our rage ancestor, forming that relationship, in my experience, allows individuals, because I've done this work with children, with individuals incarcerated. I find that it teaches us not to be afraid of this very visceral, somatic fight or flight, this response that's protecting us, right? Because it is a protective response, even more than emotion. It is, it is. And number two, it allows us to realize that there are multiple markers, beige flags before they're red flags, letting us know that we might be headed to a rage eruption, and that we don't need to get there, that we need to tend to these flames, and that flames in many of our ancestries and traditions are sacred, right? And just as much as being sad is sacred when we've lost someone. And so that we need to make space for these big emotions, or they will overtake us. And so,
yeah. Okay. So, okay. Well, I think that is, I'm appreciative of the work that you're doing, and that you see it that you've identified as a need space, and that you're doing something in that space to support people. We have seen two big examples of rage in our society. And I think that when I think about like the difference between, sacred or rage that feels righteous, rage that you can use, it sounds like, in a way, but also that gives you information for you about yourself or about your relationship to the world, and rage that is destructive, that is, ends in violence, is dangerous, is anger, I guess without focus or purpose. I think about these two things that happen very publicly for us in our society. So one, we had most recently the Alabama boat brawl happened on August 5th. You'll remember that when it happened, I said, I think we should talk about this, because what is this? And I set that alongside the insurrection on January 6th of 2021, where there was also this like very public experience of, I would say, two types of collective rage happening. Is one more sacred than the other? Is one more righteous? Are they both wrong? Like, I feel like it can be helpful and productive and instructive, in fact, for us to have a conversation looking at these two instances of rage on film.
I'm reminded, and I believe there is a person that has written a book. I have not read it. I think it's called White Rage by Carol something.
Carol Anderson. Carol Anderson. Yeah, it's a great book. Everything she writes is amazing. Again, y'all, we'll put all these books in the show notes. But as you can see, we do read up in here.
Yes, we do.
Yes, we do.
I think it's on my list.
It is not just opinion up in this situation. We are doing the work. Yes. But so Carol Anderson.
When I think of the insurrection, and when I think of not just Trump, but other individuals like himself that became the poster child to allow racism
Mm-hmm.
to continue to evolve to such a bold, disrespectful place. I mean, it's already been, it's always been,
Mm-hmm.
right? But when I think of the insurrection, I think of a rage that is not righteous, that is not sacred at all. And why I say this is because this type of rage is meant to take back power, to belittle, to harm, a power that they believe that has been taken away from them. And it also reminds me of the ways in which plantations and the institutions of slavery engaged, right? Where it is, we're going to take back, quote unquote, our country and our land. And so I believe that this level of rage is about fear.
Yeah.
It is not, it is, I'm going to say, small-minded in the sense that it's coming from a place of absolute fear, and it's coming from a place of you're going to take away my power. So I think that white-bodied supremacy has its own relationship to rage, and I think that it is not one that is evolved. Let's say that. I would bet that a lot of these people are not looking at their emotions and how they impact others. And so I don't believe that that rage is sacred, although I do believe it is a rage, but it's not for me to also say, right? So it's not, so this is my opinion, right? But I'm also, this is my opinion as a Black woman, right? Who has been deeply harmed by these structures and systems. So when I see the insurrection, what I see is a form of rage that is, I'm trying to use the word, that does not see, that is blindfolded, and that is not done any internalized work in understanding how systems, structures, power, and control continue to play out. It's based deeply on a sense of fear and reclaiming that power and doing anything possible to get that power back. And it's also based on a form, I believe, again, on a deep sense of privilege, right? That I have the right to walk up into the White House and take back my country. And so I would say that I think it's important, because I certainly don't want to do further labor, and I'm sure you don't, and many of us don't, for white folks, to look at the ways in which their rage goes unpathologized. Their rage is often seen as, what is that called? What is that called when you're like American? What is that called?
Patriotism.
Thank you, patriotism. Thank you. I couldn't think of the word.
Yeah.
And I think that patriotism, much like sometimes professionalism, is really a code word. For whiteness, or more proximity to whiteness. And when I think about the Alabama boat brawl, what I see is survival. I see a different level. So I do think that there are different levels of the rage, right? And Ruth talks about that as well in her book. And there's different levels being activated within a person. And so the same way that in the insurrection, those individuals likely were being triggered by their historical trauma. Yeah. Right? I don't know if this is making any sense.
I'm right here with you. Keep going.
They're being triggered by their historical trauma. They're, quote unquote, they're going to take something away from us. Too much affirmative action, all air quotes here. Like, we don't have enough freedom. We don't have enough rights. All of this critical race theory, right? So there's all this fear of loss of power and control. But on the other end, when I think of the Alabama boat brawl, I essentially see community coming together, right? And yes, there was definitely violence, but the violence was not occurring on the part initially of the Black folks. From what I saw, I was not there clearly.
So more survival and defense rather than.
It was much more about, I from what I saw, there was a lot of discussion, a lot of hands up, discussion, don't talk to me like that. I saw that the security guard seemed to be doing his best to be doing his job. And as a psychologist, my role is to be as neutral as possible about it. But I think that part of this decolonial work is to look about how there's nothing neutral about racism, and there's nothing neutral about the harming and the killing of Black bodies, and there's nothing neutral about the narcissism involved in white supremacy. Right. And what I saw was a level of narcissism, again, from the outside was not there, but from what I could see was a level of narcissism is I'm not moving this boat. You're not going to tell me what to do.
You don't get to tell me what to do.
Tell me what to do. And so I also noticed that there was a lot of trying to keep your head on, even with his actions, his mannerism, until the hat went off. And then there's all these jokes and memes, right? About the bat call and the and Aquaman and then the Avengers
but he was essentially, I hear you saying, like, he was trying to not have it go there, and then he got to a point where he didn't see that he had a choice.
He's trying to keep his job and his life, I believe.
His life.
And I imagine, especially when I saw in the video, two of them come up to him, and I imagine he felt afraid. And I imagine he went into his own form of like fight or flight, as well as an indignant anger, rage of, you don't get to do this to me. So to me, in my sense, that hat up was, that's it. If I have to lose my job, that's fine. We're going there. Like, I'm done. That hat up was, all bets are off. I'm going to take care of myself any way possible. And that also is a form of the rage, as I said before, with this ancestral trauma. And there's probably this grief and I imagine shame, but I didn't see this like losing head energy about this man.
I don't think he can lose head. I think losing head is what do I want to say? Losing head is the thing of slave revolt, and there are huge consequences. So if you lose head, you better take it all out, right? Like, we've seen a number of folks, number of historical accounts of that happening, and I would say a number of recent accounts of happening where, as a Black man, you can't lose your head. Actually, you can't actually access the anger or the rage that is projected onto you. If you actually did that, we'd lose all of our brothers and our husbands and our siblings and our cousins. We'd lose every last one of them.
All of them. And so I believe that teaching, re-educating, and unlearning what rage is and what it isn't, can allow for many of us, particularly queer, poor, Black, disabled people, right? Allowing individuals that are often relegated to margins and often first harmed for any sort of reaction or infraction, allows us to A, take our power back, B, continue to form a relationship with this very big emotion that could be very problematic, so that we have a semblance of control and power and reflection in deciding how we want to react and engage, but also to say that, hey, we also know how to stand up for ourselves and we're not going to be pathologized
for doing so.
So
I would just want to be mindful of time. I've taken you over by 15 minutes. How are you on time?
I'm wonderful. I'm fine. Yeah.
Can I give 5 more minutes? And I think we can wrap up these 3 questions. I know that's going to be brutal for the both of us because I can tell that we like to talk. So, but
it's not my strong suit.
I neither. I'm like, we could just go on and on and on. So She Been Ready is a conversation about Black women's liberatory leadership praxis. And I wonder if you have any thoughts about what the role of rage is in decolonizing leadership practice among Black women and other minoritized folks.
Oh, I love that. Can you say the question one more time?
What would you say is the role of rage in decolonizing leadership practices among Black women and other minoritized folks?
Yeah. Well, I think at its most purest, simplest way is to continue to embody bigness, right? Continue to embody big reactions. For Black women to continue to embody in leadership positions disagreement, right? And to continue not to educate and do the labor, but in modeling and role modeling and embodying who we are, whether we're more of a quiet tempered or bigger mouths and bigger temper, to start to undo some of this belief and bias that we're angry Black women or angry such and such if we disagree, if we're passionate about something, if we're standing up for ourselves, or even if we're feeling a bit agitated that day, that we're allowed to have a whole range of mood swings. And we are allowed to also dissent. So I think that I don't want to say that it's our job to educate, but I believe in embodying our rage and also checking it and understanding when we're becoming overly controlling, overly dominant, overly, I have to fight everyone and educate everyone around this type of racism and this type of thing, knowing when and where, and actual tapping in and tapping out and saying, this isn't my role. Where's my accomplice? Where's my wife?
Yes.
Yeah. Where, let
Who are the
her.
other people with labor in this space with me? Yes.
Because it's
I
not
love
always
that.
our role to hold that and to do that education, but I believe in embodying, again, not that we're disrespecting people, because I think, again, rage has this view where it's like we're going to walk around cussing everyone out. No. Rage can also look like standing firm on a boundary and not smiling when we really don't want to smile. And we want to say, no, colleague so-and-so, that's actually inaccurate. Research supports that, or my lived experience supports that. And
my favorite is, well, that's just not true. All right, really, I love how you lined that up with the crazy stereotype of the strong Black woman and the angry Black woman, and you know how that looks like rage to the world, but in some ways it could be rage turned inward on us to harm us, and how we might free ourselves from that, the tapping in and tapping out. So wanting to lift that up. So 2 last questions really, really quickly. One is that, you know, an important element of this show is that we want to speak to those young Black women leaders coming up and those who are rearing them, influencing them, shaping their lives. Those might be their educators, teachers, parents. Those might be mentees like the ones that you work with, folks who are early in their career. If you were to speak to them, or even your younger self, or, you know, whomever, what advice or words of wisdom would you impart to them about leadership and being ready?
I love that question. I believe that the first thing, I'm gonna actually take a minute. Hold on. Not a minute, but what did I need? Right. So often I find myself like rushing to, and what's on my spirit, what's in my heart, what I would impart is to really live through and embody the authenticity, right? In your leadership, to not lose what makes you authentically you, in order to fit into what I believe is an arbitrary frame, paradigm, square of what a leader is or should be. I would also say, please question, you know, Black excellence and what that, you know, what that can look like or feel like. And to question why we're saying sorry so much, and to really question who and what you're apologizing for being. Right. And so I would invite them to be more of themselves into spaces, and to take up a little bit more space, and to take some risks, because lightly what they're saying, or what they're doing, or what's come out of their mouth, somebody in that audience or in that classroom or in that meeting needed to hear that.
That's correct. That's real. Oh, Jen. All right, finally. And I think we've teased a few of the things that you have going on or coming up, but we also talked about being Black women who are creative and ingenuitive and innovative. So what do you have going on? What's coming up? What do you want people to be on the lookout for? We've talked about the webinars. We talked about your book, both of which we will link in the show notes. What else is going on with Jen?
Yes, thank you for asking. I am going to be putting out an energetics of and like a generational trauma webinar. So talking more about parent wounds and what exactly that generational piece looks like. We're going to be creating a decolonizing therapy course with 5-6 different guest instructors to go along as a sort of guide with a book, as well as sort of like a small group praxis where individuals can work together and be in community. So I'm really excited to create this. It's something I've wanted, and it's related to an unlearning school. We'll say that. So I think the decolonizing therapy course is really going to be the beginning of an
Mhm.
learning school
Mm.
platform. But if you're anything like me, I overthink.
Yeah,
Virgo
I
rising.
am. Yeah, yeah.
So it takes a lot for things to I'm like overthinking for like a year
Uh-huh.
and a half
Uh-huh.
before then I'm like, I want it tomorrow. And of course, then the book and my book launch, my book is coming out, Decolonizing
Yes.
Therapy, Oppression, Historical Trauma and Politicizing Your Practice in November. And there will be a book tour in the Bay Area as well as on the East Coast.
All right. I can't wait to see the Bay Area dates. I'm going to come out if I'm here. Yeah, absolutely.
Thank you
Get
so
my
much.
book signed. Jen, it's been such a pleasure to have you on the podcast today. I'm looking forward to talking with you more.
Likewise. And thank you for the work that you do in this world and this podcast.